fabulous cocktails and music from some of the best jazz artists. Delicious dinner options include mouth-watering prime rib and crusted walleye. Crooner's Supper Club, just north of 694 off of Highway 65.
Portions of the following program may be pre-recorded.
Hello, everyone, and welcome to Living Healthy and Aging Well. My name is Ken Hageland, and we are broadcasting from the AM 950 radio station that overlooks beautiful Bryant Lake Regional Park, located in Eden Prairie, Minnesota. It is another beautiful day here in the Twin Cities. I say it often, but it really is, and I am so grateful to be here with you today, and I hope all of you listening are doing well. We are on the air every Saturday from noon to 1 to talk about your health and your life. We cover a wide range of topics to help you and your loved ones pursue your highest quality of life. We have another great show for you today. Joining me in a few minutes will be Kay King, Older Adults Program Coordinator, Community Educator, and the Faith Community Liaison for the National Alliance of Mental Illness of Minnesota, also known as NAMI. She is here to talk about the mental illness in older adults and supportive resources that are available. Mental illness is not a normal part of aging. Persistent symptoms that significantly interfere with daily living and relationships may be a sign of a mental health concern. Kay will cover some mental illness basics, general risk factors, warning signs, treatment, recovery, suicide prevention, and resources for supporting older adults. You will enjoy listening to my conversation today with Kay King. All right. I want to thank all of you that leave us messages on our radio show phone line. We appreciate hearing from you, and we welcome your comments, questions, and topics for future shows. Also, if you are interested in being a guest on our radio show, please call or text us at 612-999-3426. You can also contact us on our website at livinghealthyradio.com. There you can find information about upcoming guests as well as listen to our previous shows. We look forward to hearing from you. We are adding new listeners to the show each week, not only here in the Twin Cities of Minnesota, but also throughout the country. You can find podcasts for all of our radio shows on the AM 950 radio website, as well as your favorite podcast platforms, including Apple iTunes, Spotify, and many other podcast and streaming services. You can also watch our broadcast live on the radio station's Facebook page at AM 950 Radio. If you have a question for us today, there's two ways to reach us. First, by calling the AM 950 radio station, and our friendly show engineer, Adam, will get your call on the air. Our phone number is 952-946-6205. Once again, 952-946-6205, or you can directly text us your questions at 612-999-3426. Now, don't worry if you missed our contact numbers. I'll repeat them throughout the show. All right. I want to welcome my guest for today's show, Kay King, Older Adults Program Coordinator and Community Educator. Welcome to the show, Kay.
Well, thanks, Ken. Really appreciate it.
All right. Well, there is so much to talk about. This is probably one of the areas I'm hearing more and more about is just mental illness. And it seems like ever since COVID, it's just really elevated the awareness of mental illness. So I'm just really excited to have you here. Thank you so much for taking time out of your Saturday to come in here with us and talk about it. The audience loves to know a little bit about the guest. So if you won't mind just giving us a brief background about you and whatever you want to share with us. And then we'll talk about how you then got inspired to participate with NAMI and being a part of their organization.
Happy to share that. I've actually been with NAMI Minnesota for 16 years, and it's a second career for me. Prior to working for NAMI, I actually ran large retirement communities with independent living, assisted living, and managed a home health care agency. Prior to that, I ran large hotels and resorts for Marriott Corporation, and I lived all over. Before I moved back to Minnesota, where I'm from, I actually managed a resort in Aruba. So just want you to know that mental illness is personal for me. I was born to a mother who already lived with mental illness, and my mom was a student at the University of Minnesota. And when she was 18, she had a break from reality. And that's what psychosis definition is. And so my mom was hospitalized for some period of time at St. Mary's Hospital, which now is Fairview Riverside. Went back to school when she got better. She was stabilized. And she, probably in her sophomore or junior year, I wasn't around, she actually had another break from reality, hospitalized again. And it was war years now, it was the 40s. And my mom thought, something's wrong with my brain. I must not be cut out for college. And in actuality, she was, but there wasn't much to offer in that time frame for an illness that she was diagnosed with, which is bipolar disorder. So my mom went on to live to be 82 years old, and she lived a life. She owned a restaurant in LeSueur, Minnesota with my dad. We all worked in it, including me as a small child. My mom also was a librarian in LeSueur. My mom raised two kids. When I was 7 and my sister was 15, she actually had diagnosed of the same illness as my mom, which is bipolar disorder. So my mom, when she died at 82, did not die of mental illness. My sister, who's now in her early 70s, manages, bipolar disorder. And so she lives in southern Minnesota. So I have a family passion for mental illness and always volunteered in that area, even when I was in the for-profit world, running facilities. And so I made a decision 16 years ago to actually work for NAMI. And so we are located in the state office, or I'm located in the state office, which is in St. Paul. There's a NAMI state office in all states except for 2. Unfortunately, North Dakota, our neighbor, lost funding, so they right now are without a state chapter, but we try to help out North Dakota because we border, of course, that state. We also have a NAMI national office in Washington, D.C. In all the state offices and also our national office, we have 3 parts to our mission. We do education, we do support, and we do advocacy. We're not direct service providers, so none of us are psychologists, none of us are medical doctors, none of us are advanced practice registered nurses. Those are the kind of folks that do direct services. We're not licensed marriage and family therapists, which is a master's level social worker, but we're really good at education. I spend, 40 to 50 hours a week educating the public about mental illness. And we also are good with resources. So we do have a helpline at NAMI. It's not a crisis number, but we do have a helpline that is available Monday through Friday. We have a small staff, about 35 people, and about 1.5 of those full-time equivalents are helpline people, but the rest of us help as well. So we can connect people with services. I'm an excellent first aider. I teach mental health first aid, which is an 8-hour class, actually. I've taught it for 17 years.
Oh,
And, it's the class that comparable to, maybe taking a CPR class or taking American Red Cross first aid. So you learn the basics of how to be the bridge to connect people to the help they need. I know a lot about mental illness. I know it from personal experience in my family, and I know a lot from being an educator for NAMI for 16 years. But I don't diagnose anyone. I need to go to medical school. I need to get a master's in social work. I need to be a master's level nurse practitioner. So consequently, we just want the general public to have as much basic information as they can to know about mental illness.
yeah. No, go ahead. So I think one of the things is people aren't aware that they have an opportunity to change how they think. You mentioned a great word. I've never heard this before, a break in reality. And maybe we can talk about that in the next segment a little bit here. But I think raising the awareness and you getting out there and educating along with all your colleagues and really the healthcare communities so that people know that they can seek help. And it's great to have a first call to you guys just to be able to say, hey, this is what I'm experiencing, or this is what I'm seeing as a loved one or a friend. So that these can start that conversation and start maybe that journey to help get people the help they need.
Yeah, and so it's good for people to know resources. So I do hope, in our time together that I can also give you some resources, not just for crisis, but also classes and things that you can take. One thing I'd like you to know is that mental health concerns are really early onset. So I'm going to give you a little bit of statistical information. So by age 14, 50% of people who are going to have signs and symptoms anytime in their lifetime have them by age 14. That figure rises to 75% by age 24. So it's a young person's onset. And I often ask my classes, well, how many of you had really robust mental health training in high school? Nobody raises their hand. Nobody. And that's today, as well as if I'm asking someone in their 40s or their 50s or their 60s. It's today also. It's not that no one cares about it or not that they don't know it's pretty common. It's just that in schools and things, there's a lot of demands on curriculum. And so a lot of it is parents or interested adults who work with kids. I don't have children of my own, but I certainly have been a youth athletic coach for basketball. I've been a scout leader. I've been a faith youth leader. And so in those roles, you do need to know some basics because it's such a young person's onset. Most people don't know that the most common mental illness is anxiety. They might think it's depression. Absolutely nothing wrong with that guess, but it is anxiety disorders. And that's a big tent. There's quite a few different types of anxiety disorders. But do know that it's also early onset. So with anxiety disorders, half people who are going to develop anxiety disorders in their lifetime develop them by age 11, and then the other half after age 11. So if you're a parent or you're an adult who works with youth in some capacity, it would be good to know some basics, including some basics about anxiety. Now, we all can have anxiety. That's not a disorder. I would guess that except for Ken and I, most people don't like public speaking. And so you have sweaty palms, you have butterflies in your stomach, and you avoid at all costs to have a job where you have to do public speaking. That's normal. It's just that, when it really prevents you from doing the skills of daily living, then it needs to be looked at.
That's right. All right. It's time for a short break, Kay. We'll be right back to continue our conversation with Kay King, Older Adults Program Coordinator, Community Educator, and Faith Community Liaison for the National Alliance of Mental Illness. If you have a question for us, give us a call, 952-946-6205, or text us at 612-999-3426. I'm Ken Hageland, and you are listening to Living Healthy and Aging Well.
Overwhelmed trying to make sense of Medicare? As a licensed advisor, I can help you determine your healthcare needs and evaluate your options. I'm Harvey Pearl of Pearl & Company, and I want you to have the peace of mind knowing you have the best coverage available. You deserve an advocate you can trust and coverage you can rely on. And there's no fee, ever. Annual enrollment is October 15th through December 7th. Find me at pearlsofwisdom.com. That's PERLES of wisdom.com. So we can strategize together.
The place for live music is the Park Tavern. Park Tavern has delicious food and great bowling, and now the Park Tavern's dog-friendly patio is open and waiting for you. And make sure you catch the live music on the patio. On Tuesday, Wednesday, and Thursday nights from 5:30 to 8 p.m., live music awaits you with the Park Tavern's full menu available. Reservations for groups of 8 or more are recommended. And the Park Tavern offers private and semi-private spaces for small and large groups with no room fees and no minimum spending requirements. On Louisiana Avenue, north of Highway 7 in St. Louis Park, live music and outdoor fun are back at the Park Tavern.
End-of-life decisions are not easy to make. Hi, I'm Mary T. of Mary T. Hospice Care. It's important to make sure that this difficult time is meaningful and comforting to you and your loved ones. Our hospice team provides an individualized program of physical, emotional, spiritual, and practical care so your loved one is comfortable and not in pain. At Mary T. Hospice, we understand that choosing the right hospice care provider can be overwhelming, but we're here to assist you. Learn more today at marytinc.com.
Your heart beats for generations.
Your heart is so many things. It beats all the time, and it works very hard to keep you moving through your day, keeping your thoughts clear. It's the most important organ in your body.
Every beat of your heart tells a story of love, resilience, and hope. Taking care of your heart means creating more moments with the ones you cherish. Learn more at hennepin.us/heart-beats. That's hennepin.us/heart-beats.
Peace of mind shouldn't cost a fortune. We keep things simple at Schroman Law because we believe planning for your estate and end-of-life care shouldn't be stressful or expensive. Every client relationship starts with a free consultation so clients have the information they need before making important decisions. From there, we work closely with clients to ensure they are choosing the most efficient and cost-effective plans for their specific needs. Schedule a free consultation today at schromenlaw.com. That's SCHROMEN law.com.
I'll never forget. I was driving my Sienna from Rudy Luther Toyota, and I was hit at 35 miles an hour, rear-ended square flush. If not for the structural integrity of my Sienna, I wouldn't be here right now. There's a lot I can say about Rudy Luther Toyota, about their fantastic service department and their great selection, but being able to say your car saved my life is the best endorsement I can make. Toyotas from Rudy Luther Toyota are my highest recommendation. Get one today and tell them me, Matt McNeil, told you to stop on in. Rudy Luther Toyota, 394 and 169 in Golden Valley.
All right. Welcome back, everyone. You are listening to Living Healthy and Aging Well, where we talk about helping you and your loved ones improve and pursue your highest quality of life. My name is Ken Hageland, and joining me today is Kay King. She is the Older Adults Program Coordinator, Community Educator, and the Faith Community Liaison for the National Alliance of Mental Illness of Minnesota, also known as NAMI. And she is talking about mental illness in older adults and the supportive resources that are available. Kay, how can our listeners contact your organization if they have questions or want more information?
And actually, you can just put in search NAMI Minnesota. So N is in Nancy, A is in Apple, M is in Mary, I is in ice cream, NAMI Minnesota. If you want to remember our website, it's NAMIMN.org. If you just put in NAMI, you'll likely go to our national website. Nothing wrong with that, but it doesn't have support groups and classes that are specific to our state. So I hope you will go to the NAMI national website, but NAMIMN.org, or put in search NAMI Minnesota.
Fantastic. All right. Last segment, we were talking about you and talking about NAMI, and we also were talking about some of the mental illness basics. Maybe we want to finish up on some of those topics, and we'll talk about older adults, which is really, really important, especially as our population is aging.
Yeah, thanks, Ken. Just a few more basics for you. We have classes where you can learn many more basics than I have time for today, but I'm not going to talk about specific illnesses. We're not clinicians, but I want you to know that when people are struggling, someone like myself who's a first aider, I can tell that a child is struggling in school. I can tell that they're having relationship issues with their peers. I can tell that they're having issues maybe with parents and other family members. I can tell at work, that someone is struggling. They were able to complete tasks and they were able to meet deadlines, and now something's different. I don't need to diagnose. I always say, don't diagnose your brother-in-law. Go to med school, get a master's in social work. However, you can tell that someone's struggling. So you want to get a conversation started. And if they're interested, my philosophy of life is that when the pupil is ready, the teacher appears. So you have your resources ready. And you might say, I know a few resources that could be helpful. I've noticed the following things. I'm concerned about the following things. Would you like a few resources? And if they say, nope, I'm good. Okay. When they're ready, have your resources ready. Now, sometimes there's crisis where someone could be a harm to themselves. That's a little bit different. And I will give a few resources later in the program about suicide prevention, because that's really could be a concern. But generally speaking, you need to not give unsolicited advice, because that shuts people down, and nobody likes it. I love giving it, but nobody likes receiving it. So it's good to ask, would you like a few tips, or I've seen something like this before, and I know some things that would be helpful. But, I'm just going to say in a general way about symptoms is that just know that in general, when people have a change for them, and so it's not comparing yourself to your younger self necessarily, or it's not comparing yourself to others. It's just, if you used to sleep 8 hours a day and now you're sleeping 6 hours, that's a change. If you used to weigh 100 pounds and now you weigh 140, that's a change. If you have changes, those are the sorts of things you want to note. And when you get in to see your just regular practitioner, could be a nurse practitioner, physician's assistant, could be a family practice doctor, internal medicine for kids, maybe a pediatrician, that's where you start. People do not go to specialists called psychiatrists, usually as their first concern. So you get in, and that's where we access, most of our services that way. But I'm just going to say that people on average wait 10 years to get help for symptoms of mental illness, on average, which would mean half the people before 10 years and half the people after 10 years or never. And so when you think about other illnesses, if you waited an average of 10 years for cancer symptoms, you probably would have passed away.
Right.
With mental illness, if you wait that long, you also could pass away. Untreated depression, keyword untreated, is a high risk for suicide. So you definitely, want to get in. You also could lose many jobs when you have some symptoms that aren't getting any help. You're not getting any help for. You could a estranged relationship with your core family. You could have many partnerships and or marriages end. I'm not saying those are all directly related, but you could leave a trail of that. You also could get in the criminal justice system. So you could have a misdemeanor, you could have a felony. And our goal, and my goal, is really to get people the help they need before we get to some of these things that have really dire consequences. If you have early symptoms, as many people do before age 24, you don't finish high school, it's pretty hard to be able to work without a high school diploma or without GED. I was just in Red Wing this past week, and that's where there is actually a corrections facility. It's mostly for young people, but they do have kind of an adult cohort, a small one, that is in transition, ready to go back into the community. But most are young people. And we had a transitional fair for them so that they could learn about resources in the community when they're released. But some of the people there are 16 years old, 17 years old, and there's a school at Red Wing. So obviously they're going to school there. Some are a little bit older than high school age, and they're getting their GEDs. So I just want you to know that there's lots of opportunities to try to get help for people with mental health concerns long before they get into a place like a correctional facility. One little anecdote on that is that actually one of the adult people came to the transitional fair. They came in shifts, and he came up to me and he said, "I heard you speak at Lino Lakes," because that's a state prison.
Right.
And he heard me about a year ago, and he said, "You were great." I spoke to the residents of Lino Lake, a group, and I said, "Oh, you're at Red Wing." He said, "I'm going to be actually released in about 4 months. And so we're doing work programs where we go out for the day and work in the community, and gets us in transition." And he said, "You did a great job giving me some resources for my brother who has schizophrenia." And he said, "My brother's doing pretty darn well." And so it's not often I get the loop closed.
Right, the feedback, yeah.
And it was nice because he also, was at Lino Lakes and has not been out in the community yet. He's now gone to Red Wing, but he will be soon. So, yeah. Another thing is that, so average of 10 years. And the primary reason that people wait an average of 10 years to get help for their signs and symptoms is stigma and discrimination. Now, there's other reasons too. Access to healthcare could be, one. But stigma and discrimination really is the key thing. And this is way too simplistic. But stigma, part of that is language. We use words like crazy, nuts, cuckoo. And first of all, I'm being a little bit edgy on this, but when people use those words, they're talking about my mom. They're talking about my only sibling. They're talking about my grandma. And they're talking about many of my coworkers at NAMI, and they're talking about the many, many people that I teach in the community. So the words are hurtful. The words are also dehumanizing. And in other illnesses, we wouldn't use language like, "Oh, that person is schizophrenic." People are not illnesses. People are many other things. My mom certainly was a librarian. My mom was a mother of 2. My mom was a wife. She was all those things. But on her tombstone, I'm not going to say Doris King bipolar. Okay. And so same thing even with diabetes, with other health issues. I don't say someone's diabetic. They live with diabetes, they manage diabetes, they experience diabetes. They live with schizophrenia, they manage schizophrenia, they experience schizophrenia. So not trying to be too didactic here, but it's better to say lives with, manages, experiences.
Perfect. It's time for a short break. We'll be right back to continue our conversation with Kay King from NAMI. If you have a question for us, give us a call, 952-946-6205, or text us at 612-999-3426. I'm Ken Hageland, and you are listening to Living Healthy and Aging Well.
The place for live music is the Park Tavern. Park Tavern has delicious food and great bowling, and now the Park Tavern's dog-friendly patio is open and waiting for you. And make sure you catch the live music on the patio. On Tuesday, Wednesday, and Thursday nights from 5:30 to 8 p.m., live music awaits you with the Park Tavern's full menu available. Reservations for groups of 8 or more are recommended. And the Park Tavern offers private and semi-private spaces for small and large groups with no room fees and no minimum spending requirements. On Louisiana Avenue, north of Highway 7 in St. Louis Park, live music and outdoor fun are back at the Park Tavern.
Minnesotans age 65 plus might qualify for Health Partners Minnesota Senior Health Options. The easy all-in-one plan includes personal support, coverage for medical, prescription drugs, and dental, plus many extra benefits. Eligibility information is available at healthpartners.com/oneplan. Health Partners is a health plan that contracts with both Medicare and the Minnesota Medical Assistance Medicaid program to provide benefits of both programs to enrollees. Enrollment in Health Partners depends on contract renewal.
Hi, this is Frank Brown of Minuteman Press Uptown with a question for our listeners. How important are business values to you? When you need high-quality digital print, it matters who you work with. You see, Minuteman Uptown is unique. We're one of the only union print shops in Minnesota, providing our team with living wages and benefits. We believe in second chances for justice-impacted individuals who want to contribute to the community, and we are active in local issues. We've been in the streets standing up for racial, social, and economic justice. At Minuteman Uptown, our mission is to connect all communities through technology-driven print solutions. An example of that mission is when I moved Minuteman Uptown to North Minneapolis. We're invested in this local community, and we help small businesses and local organizations throughout the Twin Cities reach their audiences. Reach out to Minuteman Uptown and partner with a printer that shares your values. Call us today at 612-870-0777 or visit us at mpuptown.com. That's mpuptown.com.
Summer is going fast, but Next Chapter Booksellers has everything you need to keep up with your summer reading. From the hottest new titles to timeless classics, Next Chapter Booksellers has something for any taste. Their friendly staff are great at making recommendations for the perfect summer read for you or your loved ones. Plus, Next Chapter Booksellers has a wide variety of puzzles and games for those rainy days. So keep up with your summer reading at Next Chapter Booksellers off Snelling and Grand in St. Paul. More at nextchapterbooksellers.com.
Discover a world of foods. Visit Shanghai International Wholesale Market, a spacious food warehouse open to the public with discounts for buying in bulk. Incredible selection of global and local foods, 500 different types of noodles, specialty items, and local foods you won't find anywhere else. Shanghai Wholesale Market, your local international food warehouse. Shanghai is just north of University Avenue off of Pryor.
With a look at your AM 950 forecast, this is Adam. Cloudy and a high of 76 today. Clouds will continue into tonight for a low of 59. And tomorrow, partly cloudy and 78. Jessica Kirsten is bringing her signature comedy style to Uptown Theater on Sunday, November 23rd. This one-night-only event is your chance to see one of the most talked-about comics live on stage. Tickets are on sale now at Ticketmaster.com.
You're listening to AM 950, the progressive voice of Minnesota.
Saturday.
Welcome back, everyone. You are listening to Living Healthy and Aging Well, where we talk about helping you and your loved ones improve and pursue your highest quality of life. My name is Ken Hageland, and joining me today is Kay King, Older Adults Program Coordinator, Community Educator, and Faith Community Liaison for the National Alliance of Mental Illness of Minnesota, also known as NAMI. And she is talking about mental illness in older adults and the supportive resources that are available. Now, we're covering all ages here, but we're going to focus this segment on older adults. And as you've heard from Kay, mental illness is not a normal part of aging. Persistent symptoms that significantly interfere with daily living and relationships may be a sign of mental health concern. Kay is going to be covering some mental illness basics here, as well as general risk factors, warning signs, treatment, recovery, suicide prevention, and resources for supporting older adults. Before we return to our conversation with Kay, I want to mention this radio show is brought to you in part each week by Minnesota Hospice. Minnesota Hospice is an independent, locally owned medical practice serving our Twin Cities communities with comprehensive end-of-life health care. The team at Minnesota Hospice provides patients and family members with award-winning end-of-life healthcare services. You may not be aware that hospice brings compassionate medical, social, emotional, and spiritual services to your home with typically no cost to you or your family. Please do not wait to learn how hospice care can benefit you and your loved ones. If you have any questions regarding end-of-life care or support, please contact the compassionate team of experts at Minnesota Hospice. They are available to answer your questions 24 hours a day, 7 days a week, and your call is answered by a registered nurse. Their phone number is 952-898-1022. Once again, 952-898-1022. Or visit them online at minnesotahospice.com. All right, let's return to our conversation with Kay King. If you have any questions for us, please give us a call, 952-946-6205, or text us at 612-999-3426. Kay, how can our listeners contact your organization if they have questions or would like more information?
I think a good place, Ken, is to start at our website or to do a search by NAMI, Minnesota. So it's NAMIMN.org for our website, or a search with NAMI, Minnesota. Also, our phone number, 651-645-2948. We also have a toll-free number for NAMI, Minnesota. It's 1-888, and then NAMI helps. And we are during business hours. We're not a crisis line, but we try to get back to people within 2 business days. Many of us, like myself, are educators, so we check our emails and things regularly. But please leave us a message and we'll get back to you promptly.
Now, one of the questions that I've got is there a cost to call NAMI? Is that, how does that work in terms of having access to you guys and your resources?
Yeah, we're a 501c3 organization. Luckily, really luckily, in this last year, we don't receive very many grant funds. And so grant funds really have been in jeopardy from federal funds, then trickling down to the state.
Yeah.
We have a little bit of grant money, but we're actually primarily funded by individual donations. So, for example, we have a walk each year. This year it's September 27th. It's always the fourth Saturday of the month of September. It's our 18th walk this year. It's at Minnehaha Falls every year, but that's a fourth of our budget. So that walk's pretty important to us, but it's individual donations from people that walk. You don't have to donate to walk. We also, most of our donations are about $100 or less.
Wow.
And so our budget's about $2.4 million for NAMI, Minnesota. But again, not very much of that is grant money. So we really depend on people in the community supporting our work. When we come out to speak, and I speak at faith communities, I speak at service clubs like the animal clubs, the moose, the elk, the lions.
The lions, right.
Yeah. But I'm speaking at corporations. We do ask if people can do an honorarium. And so for some of our speaking engagements, but we're not going to turn anyone down. We are statewide. So obviously we'd like to cover travel expenses. You probably know that the IRS rate, is 70 cents a mile. So if we're traveling to International Falls or we're traveling to Worthington, Minnesota, and we're based in St. Paul, we'd like to try to cover our expenses. And the honorarium helps us do that. So
fantastic. And people can donate online then?
You can donate online. You can also workplace giving. We are part of a health charities network giving, but you also can, if your organization that you work at uses United Way or some other, you can designate NAMI Minnesota as well.
Nice.
So there's sometimes matching funds from an employer, and then also you can donate online.
Right.
You can do stock gifts and you can do bequests in your will if you'd like to.
Wow, fantastic. Okay, so any questions about that, they can just call NAMI and get more information. Excellent. Okay, great. Thank you. All right. I know we're both itching to talk about older adults.
I am.
Let's get into that wonderful population of people.
Yeah. First of all, I have to explain what older adults are. I'm a boomer, and so don't be calling me an older adult. But for the government, it's kind of 65 plus. So when I'm talking about that, and older adults, you'll be surprised to know, is I think the fallacy out there is that, who wouldn't be depressed, as you lose some health issues, you have loss of friends your age, you go to a lot of funerals if you're in your 80s. And COVID was not the friend of older adults. That's where most of the deaths during COVID occurred. There's lots of isolation in older adults, especially, if you're in greater Minnesota, there's not a lot of transportation options if you no longer can drive independently. And so that makes it harder. You also don't have maybe a spouse or partner anymore. You'd like to think you both maybe pass away at the same time, but that doesn't
Right.
usually
Holding
happen.
hands. Yeah.
Yeah, it doesn't usually happen.
Yeah.
And so changing your living space of a house of many years or apartment of many years, that's really hard, and change is hard. We've talked about loneliness epidemic. Dr. Murphy, who was our Surgeon General, before January,
Yeah.
he spotlighted loneliness, but that was around long before this. If you live with a mental health concern that you've been managing since you've been a teenager, you tend to age with it. So it's not common for older adults to have their first incident of anxiety or depression at 75 or 80. If you took a really good psychosocial medical history of a person, you'd probably find out that maybe they had some postpartum depression with their first child, or maybe they had some anxiety as a teen. And they learned strategies, resilience. They received maybe some talk therapy. Maybe they took some medication sometime in their life, and they were quite stable. But then sometimes something else puts it in motion later in life. So the theory about mental illness is, by the way, we don't really know what causes mental illness. It's probably multifactorial. But one theory is that you're born with a predisposition, something puts it in motion. And what puts it in motion is referred to as a second hit. So trauma could be a second hit. I mean, think of the trauma. We have wildfires that are in Canada right above us. We just had horrible wildfires in California. We have a war going on in Ukraine. We have a war going on in Gaza, Israel area. We have starvation in Sudan. We have COVID that we've just come off of, but we're still there, still concerning. We have a lot of things that are going on.
And we have a 24-hour news cycle, which hammers it into us. And I've heard people say, you've got to turn the TV off. You got to turn that off, just because it is constant negative information.
Well, another story for you, Ken.
Yeah.
I had an aunt, my mom's sister, who was single, never married, and she lived in Rochester, Minnesota. And she actually loved CNN. And so during 9/11, I would call her a couple times a week and just check in on her. And I could hear in her voice that she would say things like, those poor families that have lost someone in the Twin Towers. Or she'd say, I wonder, what will happen if we're going to have further attacks. And she wasn't by nature an anxious person. So I just said, how much CNN are you watching? And this is, a number of years ago now. And she said, oh, I have it on from when I get up in the morning and, when I go to bed. And she said, I'm not watching it exclusively, but yeah, I'm watching it quite a bit because I'm concerned about this issue.
Yeah.
And I suggested maybe you can make that a little bit of shorter time frame. And she did. And actually I did, certainly not hear quite as many of those what if questions.
Sure.
And I'm not a clinician. That just is common sense to me.
Right.
Yeah.
Right. Well, we're seeing kids with the screen times and all this that just continues to amplify situations for them. And again, then what happens is the algorithms, if you keep clicking on things that are maybe negative, the algorithms continue to pour more negative at you. And so I know some of the teachers I've worked with in the high school systems said they just try so hard to get kids off those screens, and just like adults, maybe get off the TV. And life is bigger than that.
You do. I mean, as an adult, you have to limit some of those inputs as well. Yeah, it's hard. I would think it's very hard to be a parent, in this time. So, but with older adults, there's lots of things that are losses. And some of it's loss of health, and it could be loss of vision. It could be people worry about dementia.
Yeah.
And by the way, I should tell you, people ask me this all the time. Dementia is not a mental illness. It is a disorder of the brain. And you can have other disorders of the brain. You could have a glioblastoma, a cancerous tumor in your brain. You could have a stroke. You could have you could have epilepsy. Those are all disorders of the brain, but they aren't mental illnesses. And I guess my analogy is that the pancreas, you can have diabetes, illness of the pancreas. You can have pancreatic cancer, illness of the pancreas. You can have pancreatitis, all illnesses of an organ, but they're not all the same. Well, the same thing is really true with mental illness. So older adults, if you've reached the age of 80, you've already beaten life expectancy. After COVID and the opioid crisis, our life expectancy in the United States dropped by 2 years. So in the last 5 years, we've lost 2 full years, not just a 0.5 or 0.2, 2 full years. So life expectancy was 79 prior to COVID and the opioid crisis. It's 77 now. And life expectancy in Minnesota was always a little higher. So we were at 81, we're at 79. So you can just see that, there are things that can really cause people some distress. But if you've lived long enough, and I mean 60s, 70s, 80s, you have learned resiliency. You actually have there's not much you probably haven't seen in your life. And so you need to call upon some of the strengths that you have. And then we also are a little bit different. Growing up, I had relatives that were in my same hometown. I had great aunts and uncles, and my grandpa lived with us. We're a society now where you don't necessarily live by family. And it's hard because, you can pull it together for a short conversation on the phone, and kids always come home at holidays. And that's when my tours at my retirement community would just blossom because all of a sudden adult children are seeing that, there's not good rotation of food in the refrigerator, that there's maybe some appearance issues that never would have been the case at all. But in a phone call or maybe a little Zoom or something like that, you don't see those changes day to day. So that is part of the reason that we, increase visits at places like touring assisted living or touring, places like that.
All right. We got to take a quick break here, Kay. It's time for a short break, folks. We'll be right back to continue our conversation with Kay King, Older Adults Program Coordinator, Community Educator, and Faith Community Liaison for the National Alliance of Mental Illness of Minnesota, also known as NAMI. If you have a question for us, please feel free to give us a call, 952-946-6205, or you can text us at 612-999-3426. I'm Ken Hageland, and you are listening to Living Healthy and Aging Well.
I'm Rachel Schroman, owner of Schroman Law, and I believe you deserve information. Our firm offers free quarterly estate planning seminars at our office in St. Paul. At these seminars, you can learn the basics of estate planning from an attorney to help you determine which estate planning documents will meet your needs and goals in an efficient and cost-effective manner. You can learn more and register at our website, schromenlaw.com/events. That's SCHROMEN law.com/events.
End-of-life decisions are not easy to make. Hi, I'm Mary T. of Mary T. Hospice Care. It's important to make sure that this difficult time is meaningful and comforting to you and your loved ones. Our hospice team provides an individualized program of physical, emotional, spiritual, and practical care so your loved one is comfortable and not in pain. At Mary T. Hospice, we understand that choosing the right hospice care provider can be overwhelming, but we're here to assist you. Learn more today at marytinc.com.
Cafe Latte offers made-from-scratch soups, salads, sandwiches, and mouth-watering desserts.
So come check out their pizza and wine bar, or get a treat from the bakery made fresh daily. Plus, you can still do online ordering and takeout, along with gift cards. Just go to cafelatte.com and choose from their ever-changing selection of award-winning salads, sandwiches, and soups. Cafe Latte is located off Victoria and Grand and online at cafelatte.com.
Hey, it's Patrick for Zero Res. The month of July is National Carpet Cleaning Month, and because of that, Zero Res is offering a purchase of 3 rooms of carpet cleaned. Get 1 room free plus $50 off an air duct cleaning. Maybe you're having a barbecue for the 4th of July. We'll also have Aquatennial coming up in Minneapolis later this month. You want to make sure your home is fresh and clean for your friends and family coming over to celebrate. If your carpet's looking more like a snowbank in late March, muddy, crunchy, and kind of mysterious, it's time to call Zero Res, don't you know? These folks come in with their fancy schmancy ZR water. It's like regular water, but with a master's degree in cleanliness. Zero Res can handle it all. Carpets, tiles, rugs, upholstery, air ducts, basically every surface in your home can be Zero Resified. So it's time to call the cleaning pros at Zero Res today. Schedule your appointment at ZeroResMinnesota.com or call 952-ZERO-RES and ask for the AM 950 special. Backorder forward spells the same. Zero Res.
Turn to Auto Technical with your vehicle donation. Even though Auto Technical is a small nonprofit, we have helped more families with transportation than any organization in Minnesota. Since '94, we have reconditioned donated vehicles so they have a higher tax benefit. Call Richard at 612-919-5526, 612-919-5526, or autotech.org.
All right, welcome back, everyone. You are listening to Living Healthy and Aging Well, where we talk about helping you and your loved ones improve and pursue your highest quality of life. My name is Ken Hageland, and joining me today is Kay King, Older Adults Program Coordinator, Community Educator, and Faith Community Liaison for the National Alliance of Mental Illness of Minnesota, also known as NAMI. If you have a question for us, please give us a call, 952-946-6205, or you can text us your questions at 612-999-3426. Kay, how can our listeners contact your organization if they have questions or want more information?
Please look at our website, and that also will allow you to email us and or call us. But our website is namimn.org, or just search NAMI Minnesota. Our phone number is 1-888 NAMI helps. If you're in Minnesotan, 651-645-2948.
All right, fantastic. Okay, last segment. We got so much we want to talk about. Let's quickly talk about resources, though, before we jump into more crisis support.
Yeah, so resources, I'm going to give you a couple older adult suggestions. In Minnesota, we have the Senior Linkage Line, and so it's part of the Minnesota Department on Aging, and they're located in their space, and their kind of supervision is through one of the area agencies on aging. In the metro area, it's called Trellis. So they're a whiz during business hours. For example, on Medicare, if you have Medicare questions, they are whizzes. But they also get calls with mental health requirement or needs, and many times they'll even refer them to me at NAMI. But just know that that's a place to start with housing help and things like that as well. The other thing is that there are some therapists that specialize in older adults, and so you need to check your insurance first, but there are some agencies in Minnesota that have therapists that have a specialty in older adults. And so take a look through your insurance company for something like that. If an older adult in your life needs to be hospitalized, there are some hospitals in Minnesota that have geriatric units, not very many, but that means that you're going to see a medical director of that unit that is a geriatric psychiatrist, of which there are very few. And so they're already a specialist called a psychiatrist, but then they have additional geriatric training. And older adults are different, than 18 and 19-year-olds with mental health concerns. Now, there's many more resources. You certainly can get a hold of me, and I'll give you my email. I'm fine with that because I'm teaching. So it's best to reach me at my email, which is my initial K and then King at namimn.org. So KING@namimn.org. But I really wanted to spend some of our remaining time talking about crisis resources. Almost every time I teach or talk, I want to be sure people know about these. So we actually have a good resource sheet that we can actually email you. So if you called our NAMI offices, it's called Crisis and Mental Health Resources. And I'm just going to go through a few basics from it. One is 3 years ago in July, there was a 1-800 number prior, but 3 years ago, it became a 3-digit number. So nationwide, it's 988. Many of you have probably already memorized it, but it is for mental health crisis. It's 24/7, 365 days a year. And it actually took the place of an 800 number, and it is all done by phone. Now, you don't have to be the person in crisis to call. You can call to get coached. So let's say you're a family member and you really don't know what to do. You have a family member that obviously something's wrong, or maybe they've struggled with a mental health concern for many years, but now they're in crisis. And you've tried to coax them to go to see their therapist. You've tried to coax them to go to the emergency room, and you're getting pushback. And you just don't know, what do I do? I'm really worried. I'm afraid maybe they'll take their life. What do I do? So just know that you can text 988, you can call 988, you can have a chat with 988. but they're trained staff. And in Minnesota, we have 4 call centers. So when you call, there's a geolocation way to say that you're in Minnesota. It doesn't say exactly where you are because there's some privacy issues with that, but they know that you're Minnesota. And then hopefully your call will roll to a call center in Minnesota because the mental health resources vary by state. And we want someone to answer the call that knows what's in Minnesota. Doesn't mean that another operator can't help you if your call rolls to another state, but it means that they're going to have to do some hunting, whereas if you get a call center here. So we have 4 call centers. And do know that, we're an advocacy organization, so we're apolitical, but I want you to know that there have been cuts through executive orders to the agency that governs 988. It's called SAMHSA, Substance Abuse Mental Health Administration, and they've been gutted. And so just know that we are lucky in Minnesota because what has happened is that we've had a way to fund our 4 call centers for a long time. And that is that if you look at your phone bill, you will see that you're charged a few cents a month for 988, just like we've always been charged some cents a month for 911. About 30 some states do not have that. They had grants. And so when those grants ended right away, then they've had to find other resources to pay the staff at their call centers. So we are very lucky at NAMI that we have a funding, not at NAMI, I'm sorry, at Minnesota that we have a funding source. Now, do know that you'll get prompted if you call. It'll say, if you're a veteran, press 1. If you need Spanish, Espanol, press 2 or dos. And then all other callers stay on the line. Just recently, the LGBTQ plus option, the operators still know how to put someone who identifies LGBTQ plus in touch with resources because there's a high suicide rate in that population. However, the prompt can no longer be there because of government order. So just know that it still can be someone that identifies and needs a resource that's specific maybe to their gender, but right now there's no prompting that will be saying do option 3. The other thing is that we have this crisis resource sheet that I'm talking about in 4 other languages. So we have that in Spanish, we have it in Ojibwe, we have it in Somali, and we have it in Hmong, because in Minnesota, those are some of the large groups of speakers in Minnesota. So do know that you also, if you speak another language, 988 has access to translation services for about 200 different languages. If you have hearing issues, they also can help with ASL interpretation. Now, the other thing is in Minnesota, we have mobile crisis teams. Not every state does. So we have 87 counties in Minnesota, and there are 87 mobile crisis teams. They, again, do most of their work by phone, but they have the ability to come out to a home, a workplace, a faith community, wherever the crisis is. But they have to triage because they can't answer all mobile crisis events. And then 911, you're going to have to take a longer class from me sometime because we offer lots of classes at NAMI. But, you need to know kind of when do I call 911 versus when do I call 988 and when do I call a mobile crisis team. So a couple pointers. On the sheet, there's actually a QR code that takes you to the Department of Human Services in Minnesota. It lists the emergency crisis numbers for all 87 counties. My sister lives in Blue Earth County in southern Minnesota. So I have the mobile crisis number in my phone in addition to having memorized 988. And then on the back page of this sheet that we'd like you to perhaps get a hold of, there's some warm lines. And so just know the warm lines are for people that are lonely. They aren't mental health practitioners, but they will be there to listen, including hours in the middle of the night. So talk to us if you want the crisis sheet. Ken, I've been delighted to join you.
We got to wrap it up, Kay. We'll have to have you back. We're at the end of the show, folks. I want to thank Kay King, Older Adults Program Coordinator, Community Educator, and Faith Community Liaison for the National Alliance of Mental Illness of Minnesota, also known as NAMI. We thank you again for joining us today. You can join us again next Saturday for another broadcast, and thank you for listening to Living Healthy and Aging Well, where we talk about your health and your life. Until next time, choose to live well.
Overwhelmed trying to make sense of Medicare? As a licensed advisor, I can help you determine your healthcare needs and evaluate your options. I'm Harvey Pearl of Pearl & Company, and I want you to have the peace of mind knowing you have the best coverage